And with regards to hospital employment, it's one of the biggest employers within the healthcare industry. So let's go back to health professions itself. So 10% of US jobs are in the health professions, and 40% of healthcare workers work within a hospital or a hospital system. And within the hospital or the integrated delivery system, the growth in the outpatient sector is the biggest compared to services within the hospital or inpatient care. And the greatest need for new workers is actually going to be for registered nurses. Let's talk about the first type. Before we proceed though, I just want to emphasize again that all these different classifications or types are not mutually exclusive. This means that one given hospital could fit into 1, 2, 3, even 4 types. So if a hospital has been named, say, as a community hospital, that hospital could also be a teaching hospital. It could also be not-for-profit, 501c3 organization, so on and so forth. So the first type of hospital are the community hospitals. These are the most common type of hospitals in the United States, and the more recent stats actually says it's 85%. So 87%. So approximately 87% of hospitals in the United States are community hospitals. They are non-federal, short stay, so acute care beds, hospitals, and the key is the services are available to the general public. The next type would be the public hospitals, and public hospitals are government owned. It could either be owned by the federal government, the state, or the local government. About 19 to 20% of all hospital bed capacity, we talked about bed capacity, 19 to 20% of all this bed capacity in the United States are actually housed within public hospitals. Only state and local hospitals are open to the general public, so not all public hospitals are community hospitals. Veterans Administration, which is a federally owned hospital, is therefore public hospital, is not necessarily open to the general public. It is meant to serve people who have done military service and are now veterans. Continuing on with the public type of hospitals, most of these are often located in large urban areas. So they serve, that's a typo there, oops. They serve mainly inner city indigent and disadvantaged populations. Very high utilization rates. Average size is 115 beds, so not very large. They offer a lot of charity care, and they are declining. So one of the most robust public hospital system we have is the New York Health and Hospitals Corporation. So that is the integrated delivery system that owns several public city hospitals. For instance, Harlem Hospital, North Central Bronx, Metropolitan Hospital. Even within that, even though it's robustly operating, there are campuses within New York Health and Hospitals Corporation that have already closed. When I talk about later in lesson 4, there's going to be a discussion about the organizational structure of hospitals. I've actually used Health and Hospitals Corporation as an example. So let's go on to private nonprofit hospitals. They're also known as voluntary hospitals, and their primary mission is to benefit the communities in which they are located. More than half of all U.S. hospitals are private nonprofit, and they operate expenses that are covered from patient fees, third-party reimbursements, payments by either Medicaid, Medicare, or health insurance corporations, also through donations and endowments. So endowments are those estates that have been given to hospitals by people that have passed on or have died and have left basically all their assets for the benefit of a nonprofit hospital. Church-owned hospitals play a really significant role in delivering U.S. hospital services. For instance, the Catholic Church operates more than 600 hospitals in all 50 states, and they deliver care to about a sixth of all hospital patients each year. There are also some Protestant denominations and Jewish philanthropic organizations that operate community hospitals. They are non-discriminatory, therefore they are open in terms of access to care, and usually because of the nature of the organization that operate them, they are generally sensitive to the spiritual or dietary norms of the sponsoring denomination. Now, the common assumption is that nonprofit organizations do not make a profit. That is not true. Nonprofit hospitals must make a profit so that they can survive over the long term. But what is special about them is that it is illegal for them to distribute these profits to benefit any individuals, such as stockholders. That's why there are no stockholders in nonprofit. To be a nonprofit, you have to be a designation called for the Internal Revenue Service. Their designation is called a 501c3, and it gives you tax-exempt status. So therefore, you are exempt from federal, state, and local taxes, income taxes, sales taxes, and property taxes. But like I said, they should be able to meet these demands, define public good, service, education, welfare, and as I've mentioned, they cannot be distributed to individuals. So where do the profits go? Like I've mentioned, it's a misnomer to think that nonprofit hospitals are not allowed to make profits. They have to make profits so that they could be sustainable. But where do profits go? So in private hospitals, private for-profit hospitals, it goes to stockholders or board members. Stockholders, sorry. The profit, if you are a nonprofit organization, whatever profit you make needs to be reinvested back into the organization. So it can't be made as a payoff to stockholders. It needs to be reinvested back into the organization, and therefore paying more for services, infrastructure, and things like that. Now, whether nonprofit hospitals are charitable is controversial because, like I said, they still have to make money. Also, a lot of people in high positions within the hospital are paid really handsomely. For instance, it's public knowledge that there are some CEOs in hospitals that could make as much as close to $8 million a year, including bonuses. But that is nothing, of course, compared to CEOs of finance companies like Jimmy Dimon of Chase, Morgan Stanley, Chase Manhattan. They earn close to about $500 million. So if we're saying that the profit cannot be given to individuals, it could be in the form of salaries. The greatest resource in an organization are actually people. And in order for you to keep them, you have to give them competitive benefits as well as salary package benefits. So let's talk about, this time, private for-profit hospitals. And let's go back to that, sorry. So a private for-profit hospital is investor-owned, and these investors are the stockholders. They are owned by individuals, partnerships, or corporations for profit, and they operate solely for financial benefit of the stockholders. It's about making money so that you could, at the end of the year, have a dividend given out to the stockholders. And the stockholders actually are themselves investors. 5% of all U.S. hospitals are owned by physicians. So most of the private for-profit hospitals are actually owned by physicians as well, and they are operated primarily, like I said, to benefit the owners, but their success depends on how well they serve their patients. Now, let's go to general hospitals. So general hospitals provide a variety of care, and most hospitals in the United States are actually considered general hospitals. They treat a wide variety of health conditions, both general and specialized in terms of scope. These are a list of the scope of practice they have, and we should, however, not think that general hospitals are less specialized or inferior to specialty health hospitals. And the difference is the nature of services, not the quality. Now, specialty hospitals focus on narrow range of services for specific conditions or patients. It's like comparing, say, Columbia Presbyterian Integrated Delivery System Hospital to Memorial Sloan Kettering in terms of the latter one, MSK, Memorial Sloan Kettering, as a primarily specialty hospital that concentrates on oncology or cancer care. So moving on to specialty hospitals, they could include psychiatric, rehab, TB, children's hospitals. There's also emerging specialty hospitals, which is orthopedic and cardiology. So orthopedic, we have one of the best in the country, if not the world. People from all over the world come to that particular hospital, and that's Hospital for Special Surgery, and they are orthopedic in nature. So they have a very distinct area of service niche. One type would be psychiatric hospitals. So they provide diagnostic and treatment services for patients who have mental illnesses, and most services are delivered by private psychiatric facilities or outpatient treatment centers. Rehab hospitals specialize in intensive therapeutic services to restore function. So it's for people that have had injuries, either from stroke or from trauma. Children's hospital are, on the other hand, are also a type of specialty hospitals, and they are community-based. They treat chronic, congenital, cardiac, and orthopedic pediatric problems, and intensive care for a variety of conditions such as like cancer, cystic fibrosis, tissue transplants, specifically for children. And one notable fact about Children's Hospital is that they have a higher staffing ratios than in general hospitals. So how would we explain this? For instance, in nursing, it's down to at least 3 nurses per patient. Now, general hospitals, you could get as much as 8 to even 10 patients per nurse. But because of the specialty and the severity of the cases, you need more nurses per patient. So moving on, the next type of hospital that I'd like to discuss are rural hospitals. Rural hospitals are those that are not located within a metropolitan statistical area. So you can only be considered a rural hospital if you operate outside of a metropolitan statistical area. So for instance, the city of New York is a metropolitan statistical area. Officially, there are 5 boroughs, but it's one big metropolitan area. And because they tend to be in rural areas, they treat a large percentage of poor and elderly patients, and they often find themselves in financial trouble. That is why there's some special designations given to rural hospitals. Medicare rules allow the designation of critical access hospitals for certain rural hospitals that operate no more than 25 beds and provide 24-hour emergency medical services. They are paid according to the retrospective cost-plus method of reimbursement, so not prospective payment. So they could actually charge, looking back, for all the services they have given, and their services are exempted from being covered under diagnosis-related groups. They're also exempt on a lot or on some of the Joint Commission requirements because they tend to be smaller hospitals and they may probably not have the logistics and the infrastructure to meet the very rigorous requirements and standards by the Joint Commission. So therefore they are given exemption. Teaching hospitals. So when we talked about the training for doctors, hospitals that house residency programs are teaching hospitals. So teaching hospital can be called as such if it offers graduate residency programs that are approved by the American Medical Association. And their primary role is to train physicians. So they fulfill a substantial teaching and research mission, and they deliver specialized care for a variety of complex medical problems. Academic medical centers have active collaboration among a university, a medical school, an integrated delivery system, and of course healthcare professionals from the community. And last but not the least are osteopathic hospitals. Osteopathic hospitals are community general hospitals. Osteopathic medicine takes a holistic approach, and since the 1970s, however, allopathic and osteopathic physicians have been practicing side by side. So residency programs, like as we talked about in chapter 4 when we talked about training of physicians, osteopaths and allopaths, DOs and MDs train together in residency programs. Because of that, having separate osteopathic hospitals have become economically unnecessary. So a lot of them have closed because there's really not an exclusive training anymore for osteopathic or DOs. They basically go to residency programs and together with graduates of schools of medicine or what we call graduates of allopathic medicine.